Welcome to today's video. Are you curious about when to take a pregnancy test after implantation? If this is the case, you're likely eager to know when you can perform a pregnancy test after implantation. In this video, we'll explore what a pregnancy test detects and when it's appropriate to test after implantation. Understanding implantation. The first step in pregnancy implantation is a crucial step in the process of pregnancy, during which a fertilized egg attaches itself to the lining of the uterus. After implantation, the developing embryo will continue to grow and eventually become a fetus. Here are some things you can look out for to help distinguish between implantation bleeding and a normal period. What to expect after implantation. The journey of pregnancy after implantation. A fertilized egg has successfully attached itself to the uterine lining, signaling the start of pregnancy. Over the next few weeks, the developing embryo will undergo rapid changes and growth, laying the foundation for a healthy pregnancy. As the pregnancy progresses, the placenta will form, providing the developing fetus with essential nutrients and oxygen. The body will undergo many changes to support the growing fetus, including increased blood volume, changes in hormone levels, and physical changes such as weight gain and a growing belly. Regular prenatal care, including checkups with a healthcare provider, can help ensure a healthy pregnancy and address any concerns or complications that may arise. Methods of pregnancy test. There are several methods of pregnancy testing available, each with varying levels of accuracy and convenience. Here are some common methods of pregnancy testing: urine test, blood test, ultrasound, and pelvic exam. It's important to note that every woman's experience is unique, and some testing methods may be more appropriate than others depending on individual circumstances. How soon should you take a pregnancy test after implantation? If you suspect that you may be pregnant, it's important to wait until your body has time to produce enough of the hormone human chorionic gonadotropin, HCG, to be detected by a pregnancy test. This typically takes a few days after implantation. In general, most pregnancy tests are accurate about 2 weeks after ovulation or about 1 week after a missed period. However, some tests are more sensitive and may be able to detect HCG earlier. If you're experiencing symptoms of pregnancy, such as breast tenderness, fatigue, or nausea, it's important to wait at least a week after a missed period to take a pregnancy test. Testing too early can lead to false negative results, as your body may not have produced enough HCG to be detected by the test. Why false negative pregnancy tests happen and what you need to know. False negative results can occur for a variety of reasons, including testing too early, using a faulty or expired test, or having low levels of the hormone human chorionic gonadotropin, HCG. It's important to wait at least a week after a missed period to take a pregnancy test. Using a faulty or expired test can also lead to inaccurate results. It's important to check the expiration date and read the instructions carefully before taking a pregnancy test. Low levels of HCG can occur in early pregnancy or in cases of ectopic pregnancy, where the fertilized egg implants outside of the uterus. Other factors that can affect the accuracy of pregnancy tests include certain medications and medical conditions. If you receive a negative result but still suspect that you may be pregnant, it's important to follow up with a healthcare provider. They can provide additional testing and guidance on next steps. Should you take a pregnancy test early or wait? There are many pregnancy tests that claim to be accurate as early as the first day of your missed period or even earlier. However, it's important to note that this may not always be the case, and taking a test too early can result in unnecessary disappointment if the result is negative. Since HCG production after implantation can vary from person to person, it's best to practice patience and wait until the appropriate time to test. Even though it may be tempting to take a test earlier, it's best to resist the urge and avoid unnecessary stress and anxiety. Pregnancy testing can be a stressful and exciting time. Understanding implantation. what to expect during pregnancy, and the methods of pregnancy testing available can help ease your mind. Remember to wait a few days after implantation and to consult with your healthcare provider if you have any concerns. We hope this video has provided you with the information you need to take a pregnancy test after implantation. Thank you for watching. Like, comment, and subscribe.